In 2013, a group of citizens was commissioned to provide city leaders with recommendations to improve the lives of Norfolk residents living in poverty. The Mayor's Commission on Poverty Reduction has since introduced, or rather issued, its report. Susan Perry is Special Assistant to the City Manager, and she joins me along with Heike Nix of Centerra Norfolk General and Julie Dixon with the Planning Council. And all three of you have a connection, and that has to do, of course, with the welfare of our children, particularly perinatal, as they call it, when parents are becoming parents and they really need some support and assistance, and then of course upon the birth of the child. Susan, the commission itself is an important step forward for the city of Norfolk. There are some areas of focus that the commission did take a look at.
Yes, the commission really felt like they needed some dedicated areas of focus, and they really spanned the life cycle of poverty. And so they looked at early childhood development, youth education and career pathways, adult workforce development, and then neighborhood revitalization and support.
Okay, and the early childhood development is sort of what we're going to focus on today, yes, because this involves parents, new parents, children, and what happens in childhood really can have a great bearing on how one grows into adulthood.
Definitely.
And becoming a productive citizen, of course, is the goal that all cities would like its citizens to realize. So the idea of early childhood is also about having children, and there is a program that has been supported now by the city, and that is called
Yes, it's a newborn screening and referral program. And this was really important because we know that children who start behind stay behind, and that there was the ability to be able to really connect with families at the earliest stage possible really has positive outcomes for later in life and being able to interrupt that cycle of poverty. And so when the commission was starting their work, this program was in the very beginning development stages with the pilot program at Norfolk Centerra General Hospital and the Planning Council. And so we were able to get involved with that, and the commission has since supported that with funding.
Okay, great. So
yes,
you've got funding, which is, of course, a tremendous thing for anybody who's with a program. When you have the city behind you and helping you drive this forward, it can make a big difference in how it reaches people and how many people it reaches. Julie, with the Planning Council, you are really sort of at the heart of getting the connected, or getting the people connected to what it is they need. So tell us a little bit about what newborn screening and referral.
Sure, we're very excited to be part of this because we were selected across the state as one of 4 pilot sites to centralize that whole screening process and simplify it for moms and for actually any kind of provider who sees that a family is in need, and they really need time to talk through some things with somebody and figure out if it's health support, education support, some kind of social support. So we worked with the health departments and the home visiting agencies and other related partners to develop a really intensive screening form, which also includes behavioral health risk screening, which is an added research project that we did together with Virginia Commonwealth University to make sure we're identifying depression issues and anxiety and stress disorders and anything that could trigger anything going wrong later. And the whole program is just to really support and expand what the vital work that home visiting agencies already are doing in the community by giving them as much information as we can up front right away, that this is what mom or dad or grandparents or whoever is feeling in the home right now with this child either coming or recently arrived.
Right. So it helps to focus all those good things and the services to support them in the beginning, instead of having to take the time to determine them later on. So you're helping to take care of some of those
very
things
comprehensive screening, yes.
Great. And at the hospital, when a woman is having a baby, there are a lot of conditions to be addressed. Whether it's the living condition, the state of the mother's health, the state of the mother's emotional health. These are all very important things to address at that very important time in the baby's life as well as the mom's.
So whenever the baby's born, we go out and ask the mom if she'd like to participate. We have a very good number of people, about 80% of our clients actually qualify to get help through the city. So, and about 60 to 70% of them actually accept help, and then they're referred to the Planning Council. They get hooked up with home visiting programs, lactation support. They can also get help with completing their education, getting a GED. And there's significant things that they can have that they may not know that they can have. So that process, because even if you have everything in place, taking home a new baby is overwhelming. Even if you had all those things, it is. So people who are lacking resources are, the baby's more in danger of falling behind, like Susan was saying.
Support groups are a part of this whole
Yes.
continuum of care too. So that is that really new, or is it just that more people are able to be told about it up front?
I think that a lot of people don't know that 1 in 5 women suffer from postpartum depression, and it's a very common thing that happens. There's a stigma around mental health anyway, but it's not that with, especially with postpartum depression. It can be normal, it can be very, very bad depending on, but there's a range. And we did just start a postpartum depression support group to support Norfolk General Hospital. And that's how more conversations got started with that, because you already had offered postpartum support through the Planning Council, and just having resources and letting moms know they're not alone, that lots of people suffer from this.
Well, this is interesting because a lot of these issues and a lot of the supports are in the community. It is just really being able to corral them and share them with the people who really need them that has required, I think, a lot of time and thought, but it's starting to come together. And having the city behind a project such as this, you know, the implications are great. I know that there are probably data associated with this in terms of our city and our mothers and how they might benefit. Heike certainly has shared some with her hospital population. And the Planning Council, you provide not only screening for something such as this, but for a whole host of other types of populations other than moms.
Right, and we do, I mean, there's a lot of work done at the Planning Council around preventing and ending homelessness. And we have 3 strategic areas around community planning, development, information referral, and then children and family services. And under that, there's all kinds of improving the quality of family home daycares and helping daycare centers and in-home daycares to get licensed, whether it's voluntary or state licensure. There's a lot of support for that so that the kids are in a safe environment, eating nutritious meals and learning as they go. And so yes, there are a lot, like you said, a lot more resources in the community, and it's just about bringing it all together so that everyone knows how to get to it, because an average person just doesn't know how to, where to start to find them.
Yes, well, we have a show full of people in different organizations that are doing some similar things and some crossovers, but sometimes it's a little bit different. So I hope you'll be able to continue to watch, because we have a lot of information. At the hospital, when a woman is giving birth to the baby and she's overwhelmed, as you said, or can be overwhelmed, are there other things that they have to contend with as they are preparing for motherhood?
Well, there's, you know, there's a big push for breastfeeding in the United States. There's so many health benefits from it, but the culture has not shifted yet to support that. So breastfeeding alone can overwhelm someone. It's not as easy as it seems on TV. It does take some work to do it, and we do have a support group for lactation at the hospital as well. And I feel like with the Planning Council's input, we've actually been able to offer the whole gamut of services, anything that the moms might need, and we really are the whole package at Norfolk General, that we can give you outstanding care and support you when you go home. And it's very, very helpful to know and be reassured that there's programs like the Planning Council to offer that support. Instead of saying, good luck, whenever the people leave, we reassured that there is help for them if they need it.
Great, and some follow through, which is the important part, I think, for the child and the mother, and just for the community in large. So I know that this must be, you know, good to know that we've got that on a good path.
Yes, definitely. And in fact, one of the things that we have found is once we connect families with services, that there are many families that need more intensive home visiting services. And so in this year, another initiative of the poverty reduction strategies of the city is to help fund the other end of the spectrum. So we're doing really well in the screening process, and now we need to make sure that the systems are in place and have the capacity to handle the families through those home visiting services. And so that's a funded area in this year.
Okay, great, and we'll have to follow up on that too.
Sure.
So thank you, Susan. Thank you, Heike. Thank you, Julie, for sharing a little bit of a lot of knowledge regarding taking care of our moms in the community. Appreciate you coming in.
Thank you.
Thank you.
Thank you.
Behavioral health services, as we already heard, and screenings are becoming even more accessible to low-income residents. You can find out where you can go when we come back.